Well, you know, it's that time of year when kids are getting excited for summer camp, but it can also be a scary time for parents. What do you do if an emergency happens while they're away, and what if they're on some kind of daily medication? Well, First News contributor Dr. Michael Sevilla joins us now with some advice for nervous moms and dads, because basically, I mean, the kids are fine with it, but the moms and dads are thinking of what may happen. You know, some are on allergy meds, some may have asthma. Is that a concern when you're sending them to camp?
Well, it can be, especially if the child is not taking the medicine like he or she should, especially with asthma medicine. Sometimes they just take it when they get worse. But if they're away, if they're at camp, definitely have to have them take their medicine as prescribed.
Right. Now, as my son goes to a summer camp every year, and I know that they send home a ton of forms for us to fill out. Are you noticing that a lot of these programs are getting more diligent about that? They keep track better and those types of things as a doctor. I mean, are you seeing a lot of those forms come through your office?
Well, we know exactly when the summer camp, when the deadlines are, because we see a lot of appointments. But yeah, there is a lot of paperwork to be done, but it's a good review, especially with mom and dad or with the guardian, especially what their health problems are, and for immunizations, make sure they're up to date with that too.
Yeah, let's talk about immunizations. What are the most important ones? What are the ones they cannot really go away, or even like local camps, because a lot of them will go to soccer camp every day for 2 weeks right there at home, but they're with kids all day long running around. What kind of immunizations are the most important and most critical?
Well, some of the newer recommendations that parents may not be aware of, especially in your 11 and 12-year-olds, they're really emphasizing now. The recommendations are to update that tetanus immunization, and also to think about meningitis immunization as well. Everybody remembers the meningitis outbreak a few years ago, and that occurred in May and June. So this could be the time to think about getting that meningitis shot.
Right. Locally, some children died, I remember. And the reason why meningitis, you worry about meningitis in that kind of a sports atmosphere sometimes. Why is that?
Well, especially in close quarters. People usually think about it with the college students, but anybody in close quarters, especially the adolescents. We're seeing some reports of outbreaks, especially in the summertime, at camps throughout the country.
Okay. Also, because so many of these camps, it's physical related, whether it be a dance camp or a sports camp or whatever, and the kids may not be used to exerting those muscles daily for so many hours at a time, because they're in school most of the day, and it's usually after school practices. What can you do to eliminate the problem with maybe pulled muscles and I think about ACLs and things like that. I mean, you worry about that kind of stuff because it's such a demand on them. Can parents do anything about that?
Well, just to talk with their child, especially if they're traditionally not in sports or not doing very physical things during the year. Hydration is very important in the summertime. We always talk about dehydration, but stretching exercises too, and you know, pain medications, Tylenol, anti-inflammatory medicines, whatever the camp allows. Definitely check with the camp on that.
Make sure the kids are stretching though, and emphasize it before they leave. Goodbye, honey. Have fun and make sure you stretch.
That's right.
Okay. Thanks so much for being here this morning.
Thank you.